Okay, I guess we can start. Okay, so good morning again. So we will continue our discussion in cardiovascular pathology, and I think we are so far behind. So dapat nakakapagsimulan tayo yung reporting. However, so we need to finish this one until the first part of the digestive system. So sana matapos ko. Okay, so last time we were discussing on the introduction of cardiovascular pathology, in which we had a short introductions in terms of how possible pathogens are being entered or acquired, okay, and disseminate infections in the body. So yung mga portal of infections natin, or portal of entry of the following microorganisms or other means of exposure of the cardiovascular organs, okay, or structures. No, so please do remember that, and I think it was part of the reviewed items, no, during your long exam. Okay, so now, so since we had an introductions on the different way of how the possible conditions affect the activity of the heart. Okay, so last time marami tayong na discuss with regards to how the left and the right-sided or the cardiovascular failure can be developed, no? So especially if there are shunting, destructions of vessels, tapos which could lead to arrhythmia or any of the organic or inorganic possible causes. So introductions lang naman yun. Now, in the following discussions that we're going to take, we will see those etiologies. Okay, so etiologies that could affect, okay, the specific areas or specific structures of the heart. So let's start with the diseases of the myocardium. So I hope you know what myocardium is, because myocardium is the muscle part. Okay, these represent the muscle portion of the heart, in which it has this very important role. Kasi alam natin that the heart is the center, okay, that has the capability to contract and then distribute blood, okay, in the system, okay, so circulation. So anything that affects the normal circulatory system of the blood, ayan, and of course affect the heart itself, no, yun, nagkakaproblema tayo in terms of the normal circulation. Pressure, ayan, volume can be affected, and that may lead also to more severe activity or severe conditions of the other system of the body. Okay, so as a short introductions with regards to myocardium. So for its review of anatomy and physiology, so you have here, myocardium is structurally similar to skeletal muscles. However, I think I have also told you about the differences, no? So na-mention na rin natin last time yung differences ng isang cardiac muscle from a skeletal muscle. So dito, meron din siyang striation. That's why the skeletal muscles and the cardiac muscles can be similar to that extent. However, the activity, in terms of activity, cardiac muscle is involuntary, so not unlike your skeletal muscle. So aside from that, there are other constituent of the myocardial fibers or myocardial muscles that cannot be seen as part of the skeletal muscle. Okay, so aside from that, disorders better appreciated through histopathology than gross exam because it's very difficult to see in the gross exam. Like for example, we have a common descriptions of enlargement of the heart, but we cannot see if those enlargement happen in a certain area lang or totally the structure of the heart or a portion of the chambers. Kasi later we will talk about the hypertrophy in terms of, or that could lead to pressure overload or volume overload. So titignan natin, doon lang ba sa ventricles or totality of the structures of the heart. Okay. So what else? Diseases leads to cardiac insufficiency or cardiac failure. So I've just mentioned this one, that everything that affects the circulation or affects the heart itself, pwedeng led to ano yun, functional, okay, systemic functions of the body. Okay, so napaka-importante. And I think I've told you about how the heart affects particularly the pulmonary circulations and the systemic circulations, and what organs become the parang major recipient of the destruction. So we have the liver, we have the kidney, kasi these are the organs that receive, okay, yung output, okay, the cardiovascular output, okay, from the circulation. Yan. So let's see this one. So this picture shows you how a typical heart might adopt or render disease. Okay, so makikita natin yung normal myocyte natin, certain fiber, no? Yung cell, okay, muscle cell of the heart. So ito yung kanyang cross sections, typically showing you the ventricles. Okay, the left and right ventricles and the muscle. Okay, the septum. Yan, nakikita nyo naman. Now, how these normal myocytes can adopt, that might lead to enlargement, okay, individually, okay, or yung hyperplasia kasi it's quite hindi masyado dito sa heart kasi wala naman tayong sinasabing mga regeneration part or anything like that, limited lang. But most of the time, what happened in the myocardium is enlargement of an individual fibers, okay, or yung myocyte. Ayan. So, ang kanyang picture grossly is like this one. Now, in the left picture, you can see here how become thicker, okay, yung kanyang hindi pala nakikita yung pointer ko. Yeah, so this how it looks like. So this is the normal one. Then how it became this. Okay. Adapt to certain conditions. Let's say that the body needs more oxygenation. So through blood circulation yan, no? Or let's say that the circulations might be exposed to certain, let's say, mga conditions affecting the lung. Yan. So, pwedeng affecting the lower part or systemic condition. Yan. Pwedeng may mga sakit, systemic na sakit. Or yung, basically, mas okay pag dun sa lung natin, sabihin natin, mas mabilis kasi it affects yung oxygenation. So, the body can, whatever the conditions that might be presented, okay, to the body is able to adapt. However, in some instances, or meron tayong saturation point na sinasabi. Okay, if the body has this complete requirement to adapt to such changes, then the body or that organ can able to adapt. However, let's say that the heart is already pero hindi na siya normal, or let's say 75% or 25% may problem siya. So meron lang tayo dong expected ano yun, expected what they call this one, for the heart to compensate. Okay, so beyond that capacity, then it will lead to disease. So yan, papasok na degenerations, and worse, it could lead to cell death. So how can you say that? So ganito yung nangyayari. And in our general pathology, so maraming pwedeng mag-cause ng pwedeng cell death, okay, dun sa heart. Always remember that anything that led to death, okay, individual or a group of cells dun sa heart natin ay very crucial. Kasi yung heart, though meron siyang great reserve, ayan, kaya lang kapag ito ay na-compensate or let's say nagkaroon ng problem in some portion, ayan, lalo na pag myocytes or yung muscle part ang affected, then it might lead to reduction of its activity. So kaya kapag may infarction or ischemia pa lang, so if there is ischemia, kasi ischemia can lead to infarction or cell death, no? So yun pa lang sabi nila sa human, no, if you are diagnosed to have a heart ischemia or yung mga ischemic conditions, you will be parang monitored. Ayan, kasi may mga gamot na ibibigay na sa'yo dyan. Kasi pag may ischemia, alam natin that a portion has received reduced oxygenation. It might be a lot of conditions. Ayan. So pag doon nagkaroon ng infarction, doon tayo magkakaproblema. Okay, infarctions can lead to death. Death of not of the heart, but death of an individual. Okay, so this is how it will be described in terms of the reaction of tissue to such injury. So ito yung kanyang adaptation. So adaptation and to a certain level, kapag naging sublethal to lethal, ito yung mga morphologic and histologic conditions that can be observed. So limited reactions, we have the atrophy and hypertrophy. But then again, mas marami yung conditions that reflect hypertrophy. Okay, and this atrophy and hypertrophy can be reversible morphologic alterations due to workload requirements. Okay, and for sublethal, ibig sabihin dito, there is a chance that the possible reactions or conditions that the heart is experiencing might lead to degeneration, okay, due to sublethal injuries. Yan. So it could lead to development of these lesions. So fatty degeneration, lipofuscinosis, vascular degenerations, myocytolysis, and mineralization. So the myocytolysis here and mineralizations is a little more, ano tawag ito? Severe when you compare to fatty degeneration, lipofuscinosis, and vascular degeneration. However, di ba, we've mentioned and talk about fatty degeneration as the earliest sign of yung cell undergoing necrosis. Sa myocytolysis kasi and mineralizations, nandun na sila sa degree of necrosis. Ayan. So, kapag nakita na yan ng ganyan or it was observed na may ganyan, medyo severe na yung effect ng, medyo severe na yung conditions. And one of the expected pathophysiological conditions that can be observed is the CHF or the cardiovascular heart failure. Ayan. So, yun yung heart failure na yan, yan no yung medyo lethal pagdating doon sa affected individual or affected animals. Okay, so that's how it responds to particular conditions. So this is how it looks like when there's a band necrosis. So nakikita nyo itong mga hyaline. Ayan, so there's a hyaline degenerations in the part of the affected muscle fibers, and of course there are inflammatory cells. Polymorphonuclear cells are found in between the interstitial spaces of the myofibers. This is a contraction band necrosis. Yung mga pinkish na yan, in which also the striations cannot be seen. And then for myocardial scarring naman, yung depositions of fibrous connective tissue or the yung replacement, okay, of an active or normal myofibers is replaced by fibrous connective tissue. Aside from that, you can also see here some of the inflammatory cells. Okay, so ganito yung itsura kapag nagkaroon ng myocardial death. And if the myocardium or the muscle heart, okay, yung muscle the muscle part of the heart is changed by different, okay, yung tissues na yan, then it will not be the same in terms of its function. So magkakaiba na yan. So if that happens, no, syempre, it will reduce. Okay, so expected mo, the activity of the heart to pump blood and others can be reduced. Ayan. So, ito yung myocardial scarring, medyo nasa stage na pwedeng mag-lead to heart failure. Okay, so however, sabi ko kanina, since the heart has this greater reserve, so myocardial regeneration still is not or limited. So very very rare 'yan kung magkaroon, kaya scarring ang nagiging parang alternative niya. Okay, and always remember that those cells that do not have the capability to regenerate, then yung repair part niya is through depositions of connective tissue, to repair that area of affected tissue. Okay, so this is also another picture of apoptosis. So myofibers shrink and from apoptotic bodies, nakikita nyo naman yung mga black na yan. Okay, no inflammation since it is an apoptosis and minimal fibrosis. Okay, so although apoptosis is as an organ, a programmed cell death, it physiologically, pero apoptosis in some tissues, okay, ay nagiging pathologic. Okay, so maraming pathologic apoptosis. These pathologic apoptosis are those that is being regulated by untoward reactions of mga lethal genes or through exposure of some yung mga lethal conditions or lethal parang pwedeng radiations, yan, chemicals here, and activate yung premature apoptosis or unregulated apoptosis. Yan, ang ano lang dito, ito yung necroptosis na sinasabi, no. Ang nangyayari lang talaga dito is that wala kayong inflammations or very little inflammatory conditions can be found or no inflammations at all. So, how will you know that? So, wala kayong makikita inflammatory cells on their area or regions where the tissue is degenerating. Okay, so wala kayong makikita dyan. Okay, so as you can see, this one, ito yung mga apoptotic bodies. Okay, so how now, okay, yung mga pathophysiology that will be observed if the myocardium, or let's say the heart itself, yung muscle part is exposed to these different cell injuries. Okay, so these are the compensatory mechanisms. So we have divided into peripheral adjustments and cardiac adjustment. So ito yung kaya niya. This is the hemostatic response. Okay, yung capability or compensatory mechanism that the heart can do, okay, to compensate for such conditions. However, sabi ko nga, meron tayong tinitignang saturation point. Okay, kapag na-meet na niya yun at dire-diretso pa rin exposure na from that condition, then what will do next is that mag-degrade, okay, yung kanyang activity, or because especially yung mga supporting structures ay pwedeng mag-degrade. So if that happens, no, syempre, lalo na yung masisira. Okay, so for the peripheral adjustments that the heart can do, cardiac dilatation, myocardial hypertrophy, and increase in heart rate. So these three are very evident. Okay. Makikita naman yan through radiology, tapos in a way na you can assess during the vital physical assessment, yan, especially sa increased heart rate, kaya nga dapat you are familiar with the heart rates ng mga animals. Myocardial hypertrophy can be seen through assessment sa visualization, yan, and cardiac dilatation. Okay, cardiac dilatation is different from your hypertrophy, so later we will talk about the differences. So this cardiac dilatation hypertrophy will try to increase, okay, allow it to increase the filling, okay, the filling of the chambers or the filling of the spaces, okay, doon sa loob ng heart, especially during diastole. So ito yung pag-come up or pag-fill ng blood enter, okay, doon sa isang mga hanggang doon sa ventricles, okay, so pag ganyan siya. And then afterwards, no, we have the increase in peripheral resistance, increase in blood flow, and redistribution of blood flow. So these three naman for the cardiac adjustment, so ito naman yung how the heart capable to give back, okay, to the circulation. So ito yung adjustment niya. So since the peripheral adjustments dun sa labas coming into the heart, okay, it's supposedly or should balance yung kanyang paglabas, okay, doon sa papunta doon sa redistribution ng blood in the system. So hanggang doon kaya niya. These are the adjustment that the heart can do. Okay, so there are 6, no? For the peripheral adjustment, we have the cardiac dilatation, hypertrophy, and increase in the heart rate. Actually, the increase in the heart rates will be one of the reflection of the cardiac dilatations and hypertrophy. And for the cardiac adjustment naman, increase in peripheral resistance, volume, and of course, there will be resistance or distributions of blood flow within the system. So always remember that this compensatory mechanism is not it's not infinite. Okay? So limited pa rin 'yan. Kasi later no, we will see the requirements, okay, that the heart should have, okay, para mag-undergo siya ng compensatory mechanism. Kasi one or two of that ay wala, then this compensatory mechanism will not be happen. Okay? So walang mangyayaring ganyan if the heart, okay, will not parang succumb to the or will not comply. Okay, so hindi siya compliant dun mga requirement na yan. Okay, so what happened in cardiac dilatation? So there will be stretching of cardiac muscles. Sabi ko kanina, there will be increased filling in of blood, especially in the diastolic, okay, picture. Okay, so if there is a stretching of cardiac muscles, then it will lead to increase in the contractile force, leading to an increased cardiac output. So ibig sabihin, this is a parallel and a domino effect, no? Dapat supportive siya, okay, doon sa first pa lang na activity. And then if there is an increased cardiac output, then the stroke, okay, of volume beyond limit. Yung sinasabing beyond limit is from the normal one. Kasi in the compensatory mechanism, we are establishing a new what? We are establishing a new homeostasis. That new homeostasis is now the standard, okay, of the heart. Okay, unless malilesen or unless yung exposure na from that inciting stimuli, okay, inciting stimuli ay mawawala. Okay, so since compensatory, pag nawala yung inciting stimuli, pwede siyang bumalik dahan-dahan or gradually dun sa kanyang standard. Okay, mag-set na naman siya ng next na or other level of homeostasis. Okay, so dito lang sabi, there's increased stroke beyond limits will equal to decrease. Ito na lang, ang nangyayari naman dito, since there is, yung isa kanina is beyond its standard, pag more than that naman, and then there will be decrease in the contractile strength. Ang nangyayari sa mga cardiac dilatation na yan, lalo na dito sa kasi pag cardiac dilatations, yung itsura, structure is that nag-dilate. Okay, so not necessarily kumapal, but dilated. Okay, so yung pagkakaiba nila pagdating doon sa hypertrophy. Pero pagdating later, no, meron din yung hypertrophy na dilated din. So aside from hypertrophy, may dilatation pang nangyayari. That's why one of the button here describes that cardiac dilatation is a terminal lesion. Kasi once dilated, it's very difficult for it to return it back again. So the causes, okay, of this possible cardiac dilatation is insufficient time, inadequate nutrition, and diseases of myocardium. Take note, these three is actually the reflection of those requirements needed, okay, to have a good compensatory mechanism. Kasi later, no, doon sa compensatory mechanism, kailangan ng time. It should have a sufficient time for the heart to adjust for the compensatory mechanism. Another, the heart should have adequate nutrition to support, okay, the compensatory mechanism. So ano ba ginagawa compensatory mechanism? Hypertrophy. Anong kailangan niya? There should have high protein nutritions that will nurture yung mga protein needed, okay, to increase in the size at the same time for the productions of energy, ayan, para dun sa contractility. And of course, it should be healthy. The myocardium should be healthy. So if those three are not supported, okay, or so, meron tayong problema doon kahit isa lang, then the compensatory mechanism will doomed to fail. So yun lang yung problema natin doon sa compensatory mechanism. Okay, so under cardiac dilatation, we have the acute and chronic dilatations. For the acute one, so this is an abrupt response, especially if meron mga toxic products, ayan, so resulting to dilatation and extreme exertion of the heart muscles. Ang nangyayari dito, pwede itong biglang pag biglang nagkaroon ng extreme exertion, pwede magkaroon ng mag-breakage, yun yung mga problema natin, no? Pag sa mga acute dilatations, that it could also lead, okay, pwede yang mamatay, okay, depende kung gaano ka-extent yung exposure niya sa isang acute stimuli, okay, na pwede naman yang hanggang direct cardiac dilatations na. For chronic dilatations, dito naman, there is a several month or days or long-term development. Okay, distinguishing from acute form by the presence of hypertrophy. So I told you a while ago that hypertrophy can also be mixed with cardiac dilatation. So ang nangyayari dito, there is a stretching, okay, of the sarcomere. Okay, ito yung sa muscle portion, no? And then lumalaki 3 to 5 times, okay, yung reserve capacity niya. Okay, yung sa heart muscle. So that is the cardiac dilatation. So when it comes to the compensatory mechanism view. So parang ang tanong ngayon, Doc, maganda ba siya o hindi? Maganda in the sense that the body trying to compensate for the conditions para hindi mamatay. Okay? So parang pro-life pa rin siya. But then again, there are consequences, okay, of this compensatory mechanism. Okay, so yun lang yung problema natin dyan. That when these consequences will be observed, dun, hindi na yan babalik sa normal. So, dun na pwedeng mag-originate yung different diseases of the heart. Okay, it could pwede siyang terminal or pwedeng talagang long-term development. Yung iba naman, it could be parang controlled. Okay, however, chances are, pag pag complicated pa siya with other infectious conditions, dun nagiging problem. Kasi ang usual picture niya is yung congestive heart failure. Ayan, yung congestive heart failure yung kanyang itsura. Okay, and if there's congestive heart failure, expected mo na, okay, na pwedeng apektuhan yung, it's either the pulmonary circulation for left, and for the right naman is the systemic circulations, the liver and the kidney. So yun yung problema natin. Okay, so for the myocardial hypertrophy, this is a long-term mechanism. Up to such, the heart is still able to compensate. So this response to maintain an adequate output of the heart in the condition of increased pressure or volume overload. So ito yung dalawang type kasi ng hypertrophy. Later we will talk about that. Now, pathological hypertrophy, so myocytes have impaired intrinsic contraction and relaxation. So ito yung magkakaroon na ng impairment o hindi na kinakaya. Okay? And the causes of this hypertrophy may lead to stenosis or insufficiency of the valve through which ejected blood must pass. So dahil makapal na siya, so it affects now the volume, okay, and of course it will increase pressure. Okay, so kapag nagkaroon ng ganon, then ano mapipilitan ma-affect na other structures? Siyempre yung valve. One is the valve. Why valve? Di ba yung valve is a structures that prevent the backflow. Ayan. So, kapag masyadong mataas ang pressure, what will happen? So, pwede niyang i-push hanggang magkaroon ng parang yung valve na yan is incapable na. Okay. Na ma-hold niya further yung backflow. Okay. Or yung pressure. Hindi niya ma-long stand or ma-withstand. Okay. Yung pressure in between chambers. And I would like to note na kapag sa backflow kasi, there is a chance that oxygenated and unoxygenated blood can be mixed or magkakaroon tayo ng cardiac tamponade. Okay, doon sa isang area. May mga backflow papunta circulations or doon sa pulmonary. That's why pwedeng maapektuhan both systemic and pulmonary circulation. Okay. So, by the way, stenosis is thickening. Okay, so reductions of the lumen. Ayan, so baka makalimutan nyo lang. Okay, so the pathophysiology or the development of myocardial hypertrophy, so there's an increase in the size of myocardial fibers, increase in the number of myofibrils, but not the myofibers. So myofibrils, yung maliliit na. And then increased number of mitochondria. So these are the structures supporting, okay, the increase in the myofibrils. Okay, so there's an increase in the energy. Okay, however, mitochondria are not in the increased number compared to the size of the myocardial fibers. So there is a chance that hindi siya parang anong tawag mo dito? Equal. Okay, so yung equality ay nagkukulang siya, no? Kasi sabi niya increased number of mitochondria, but mitochondria are not in the increased number compared to the size of the myocardial fiber. So nag-increase yung mitochondria natin but not enough, okay, for the size of the myocardial fiber. Another, there's an increase in the number of ribosomes. Why? So kailangan niya ng protein. Okay, so especially nag-increase siya ng mga fibril. So kailangan niya ng mga protein for contractions, the actin, the myosin. Okay, synthesis of normal proteins can be expected, lalo na kapag ito ay long term. Okay, so hypertrophy. At na yung possible origination of pathology. Okay, so pwede na yung mag-lead. Okay, so pag nagkaroon ng mga lesions found, so ito yung pwede niyang pag-startan. So ano ba yung mga synthesis of normal proteins? You can say hyalin, it could lead also to, what's the other one? Amyloidosis, mga amyloid. Okay, there's a lot of synthesis of abnormal proteins. And abnormal proteins are not good. Okay, kasi hindi siya the same, or yung reflection for its function is different from the expected one. Okay, so increase the collagen, so interstitial reaction, and there is increased cell volume compared to vascular supply. So increased metabolic requirements and oxygen consumption. So these, okay, actually these follow. Okay, so ito yung mga susundan niya, no? Kung makikita nyo, the mitochondria and the cell volume are the parang negative part na pwedeng pagsimulan ng kanyang pathology. Okay, yung kanyang disease thereafter. Okay, kapag na-saturate or sa long-term hypertrophy. Okay, so the stages of myocardial hypertrophy depends on the initiation, stable hyperfunction, and deterioration of function associated with the generation of hypertrophied myocytes. The number 3 now is the time, okay, na pwede nang masabi that the heart is reaching, okay, yung parang level ng saturation level. Okay, hanggang dun na lang siya. Okay, hanggang dun na lang yung kaya. That beyond that limit, then it will be deteriorate. It will deteriorate. Okay, so initiation, the requirement for the initiation is syempre time, nutrition, yun sabi ko kanina. Stable hyperfunction, so once na-establish na siya, dapat hanggang dun na hindi siya fluctuating. It should be a stable compensatory function. Okay, sa hyperfunctions. Ito yung creating new homeostasis. Okay, for that condition. Kasi nga, magko-compensate siya. May problema yung body that it needs to parang comply for the yung cardiac blood output. Okay, yung cardiac output, yung blood that should be circulated within the system. Okay, and then of course, those requirements, ito sabi ko na kanina, yung time, adequate nutrition, healthy myocardium. So I've mentioned this one. So kapag ito ay walang requirement or isa sa dalawa nito ang magkakaproblema, inadequate ganyan, then there will be no complete there will be no complete compensatory mechanism. So if all the said conditions are lacking, then the result is dilated ventricular chamber and heart failure. So the two pictures here shows you a normal one and a hypertrophied cardiomyopathy. So this one. Okay, this is how it looks like. Okay, the ventricles are affected and a portion of the septum no sa area niya. Okay, so interventricular septum here, the muscles na meron siya, then it will increase. So yung stenotic area dito, ito, yung mga lumen in between. Okay, so yun yung part ng stenosis that could insufficiently, okay, because of the pressure and the volume, okay, hindi ma-hold, okay, completely ng mga valves. Okay, so characteristic of hypertrophied one is cardiac wall become thicker, larger in both external and internal dimensions. Ito both pwedeng sa labas at pwedeng sa loob. That means it could be a eccentric hypertrophy or the concentric hypertrophy. Weight is abnormally great. That's why in pathology, especially in doing the necropsy, I want you to have your weighing scale. That is for you to know whether the tissue ay ang tawag dito, lumaki o hindi. Kasi it's very difficult na, merong megaly dyan. Paano mo siya masusuportahan? Yan. So rubbery in firmness, especially if you hold that, no, makikita mo naman okay, by touching. And then myocardial fibers increase in thickness. So yan yung mga makikita nating changes, okay, morphologically. So for the cardiac hypertrophy, so right ventricles and left ventricles can both be affected. So for right ventricle, there's some obstructive process of the lungs, okay, such as the diffuse of fibrous tissue that thickens the alveolar wall, chronic passive congestion, pneumoconiosis, and pulmonary stenosis. Okay, and for the left ventricle naman, aortic stenosis, atrial hypertension, and nephrosclerotic change. So this can be affected, okay, as a consequences when there is a cardiac hypertrophy, especially in the pathologic side of cardiac hypertrophy. Okay. So, ito yung nangyayari sa itsura ng left ventricular hypertrophy. There is a thickness of the left ventricle wall above 15 millimeter. So, ang kapal. So, 15 millimeter. Ganito. Ayan. So, makapal siya doon sa single lang na ganito, no? So, that's indicative of significant hypertrophy. So, ito yung mga cross-sections niya. Okay. So, if you will notice, no? Yung normal heart natin ay nandun sa gitna. Okay, gaano siya nagkaroon ng, gaano kalaki yung increase niya dun sa left side, ito, and then gaano naman yung tsura niya na lumaki naman siya in terms of on the right side. Okay, so dito yung pag-uusapan natin later in terms of the different type of hypertrophy. Okay, so if you will notice, no, yan yung changes. Okay, ng iba. So, you cannot judge, okay, yung heart by just merely focusing on its morphological change. So, dapat makita mo talaga yan, i-cut mo siya, and though, lalo na pag intact, hindi mo naman siya kinat and histopad para makita mo in detail what are the affected structures within the increase in this part of the myocardium. Ayan. But then again, it's definitely there is cardiomegaly. Okay, both. Pero kapag hindi mo siya binuksan, hindi mo alam if it's ventricle or the whole structure of the heart. Okay, so yan yung itsura. Kapag nag-check kayo, so cross-section and at the same time, yung lateral section can be examined. Ayan. Okay, so for the cardiac hypertrophy, na-mention ko na to, no? Para we can relate that to this picture, these two picture from the left to right picture. So the first one is the concentric hypertrophy and the second one is the eccentric hypertrophy. So for the concentric hypertrophy, there's an increase in the muscle mass without increasing the size of the heart. Pero may increasing kapag winay mo siya mabigat. Bakit siya mabigat? Nung cross-section mo to, ganito ang itsura niya. This one. Okay, so ganyan ang itsura niya. So, there is stenosis. So, parang wala ng lumen, konti na lang lumen. So, may pressure. Okay, now, for the eccentric, increase in muscle mass with corresponding increase in gross size of the heart. So, if you will notice na parang ganyan siya. So, lumaki siya. Just like this one. Okay, so ganyan yung itsura ng eccentric hypertrophy. So, kaya nga relate ito na volume overload. So, dito naman pressure overload. Okay. So, both hypertrophies are compensatory changes, but it can be different from cardiomyopathies. So, these, yung cardiomyopathies kasi natin, it's conditions affecting the muscle beyond compensatory mechanism. Okay, so not necessarily may compensatory mechanism. Okay, lumalaki siya. So that is the difference between the hypertrophy for compensatory mechanism and hypertrophy development kapag may cardiomyopathies. But then again, the picture of the two is similar, yung itsura niya. Okay, so ito yung kanyang schematic diagram and changes. This is the physiologic hypertrophy, the concentric hypertrophy, and the eccentric hypertrophy of ito naman is more of the pathologic conditions, okay, ng pag may cardiomyopathies. Okay? So, for the concentric hypertrophy, this could be seen in a cardiomyopathies. Ayan. So, this is known as the pressure overload hypertrophy, in which there's an increased mass of ventricle without increased end diastolic volume. Okay. Then, this also includes increased numbers of sarcomeres parallel to long axis of the cells. So masasabi mo to in a cross section, okay? And the histopath examination. Okay, so ganito yung itsura ng concentric hypertrophy. Now, for the causes, if ever, no, there will be pulmonic and aortic stenosis. Kasi pumapal siya dito eh. So the pulmonic area, okay, papunta doon kasi this is increase, no, affected. And then pulmonary and systemic hypertension if both of the ventricles are affected. And of course, if there is hyperthyroidism in an old cat kasi it affects the metabolic activity. Okay, especially dun sa mga degenerations, or let's say not degenerate, but the productions of abnormal proteins. Okay, so morphology, there is increase in the right side of the heart, that is the right ventricular hypertrophy, or in the left side, that's the left heart, left ventricular hypertrophy, or both. Bilateral hypertrophy, which is a more rounded or Valentine shape. So yung mga perfect shape nyo na Valentine is actually not a normal heart. It already reflect a enlarged heart. Okay, yung mga Valentine heart na yan. Okay, so lalo na kapag both ay lumaki. So parang laking ganyan. Okay, that is a abnormal heart. Okay, in terms of the due to hypertrophy reaction. Now, for the eccentric hypertrophy naman, nasabi ko na kanina, volume overload hypertrophy, there's increases chamber size, as you can see, no, yung previous pictures natin, that it increases. Okay, kasi lumaki yung heart natin, may large enlargement talaga. So cardiac silhouette is rounded than normal, so more of a globus heart. Yan. So that's why sinasabi to globoid heart or the end stage change. So para siyang parang it resembles the cardiac dilatation. That's why I told you, no, a while ago, for the cardiac dilatations na pwedeng mix siya with cardiac hypertrophy. So increase in the myocardial mass plus increase in end diastolic volume because of that high volume na papasok doon sa chambers, which increase ventricular volume. Okay, so yun ang magsisave doon, syempre, yung ventricular chambers, okay, yung ventricles. Then this will increase also the number of sarcomeres in length and width. So that's the difference between the two. So yung isa, you cannot see the enlargement because the enlargement ay papasok. Okay, so ganun pa rin yung itsura niya, but then again, nung winay mo siya, mabigat siya. And then when you do the opening, okay, so nakita mo there's an increase in the ventricular mass. And then this one, you can see talaga enlargement of the heart, may cardiomegaly. So upon opening it, distinguishing it from the other type of hypertrophy. Ayan, so ito yung itsura niya. Okay, so to see it more differently, so this is the centric hypertrophy and the concentric hypertrophy. Okay, sustained volume overload, sustained pressure overload. So yan yun. Volume overload hypertrophy, that reflects your centric hypertrophy, and the pressure overload hypertrophy, that reflects your concentric hypertrophy. Okay, so the next topic is actually cardiomyopathy. So I will end to this one because it's already 9. So please do read on the cardiomyopathy. So we will discuss this further until hanggang next week. Ayan, so matatapos ko sana lahat ang cardiomyopathies on not cardiomyopathies but cardiac. Okay? Discussions natin next week. So you read on cardiomyopathy. So I told you a while ago that this affects heart muscle diseases. Okay? So it could be inflammatory or non-inflammatory. So the contractility, so decrease in contractility leading to cardiomegaly and congestive heart failure. And this can be seen in both human and animals, particularly man, cat, cattle, pigs, and dogs. So there are two types, the primary and secondary cardiomyopathy. So we will talk about that. So sa susunod na lang na discussions natin. Just know how cardiomyopathy is differentiated or different from compensatory mechanism, especially if there is cardiac hypertrophy. Kasi yan ay pwedeng ma-reflect din pagdating dito sa cardiomyopathy. Seeing it that one of its lesion is cardiomegaly. Okay? So you have already this presentation, you have the LRP, so you read on that. Okay, so thank you very much for today. Any questions? We can address your questions maybe on next meeting because it's already 9, unless you don't have class. So I can address that. Kasi kung wala tayong class, we can extend kung gusto nyo. Yun lang. I want the opinion of the body naman. Hello? 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 Hello, naririnig nyo ako?
Yes, Doc.
Oh, yes. Thank you, Mr. Juriel. O ano? May klase kayo?
Doc, wala naman po pero tinatapos namin yung activity, Doc.
Ganun ba? Okay, sige. So, see you na lang, Garod, next week. Walang Monday eh. So, maybe Wednesday again. Ayan. And hopefully, if you have free time, kung pwede tayong humabol Monday dahil kasi free naman ako basta wala mag-defend between 9 to 12 at wala namang ano. Can we have yung parang make-up class para lang matapos ang cardiovascular next week? Katuloy na tayo at meron pa tayong digestive. Pwede niyong pag-usapan sa class.
Sige po, Doc.
Okay, sige. Okay, so thank you very much for today. If you don't have any questions or clarifications, now if you have, then you just chat me, no? And then I will just answer na lang din. Or we can discuss that during the discussions next meeting. Okay, thank you very much and have a healthy and stress. Okay, unstress weekends yan. Dapat hindi stressful yung weekends nyo. Pahinga lang kayo. Okay? Thank you very much, guys, and good morning.
Thank you for that.